Hi, it's Jane, and I'm back with my third talk. As I say, I'm used to talking about gardens, so I had to go and sit out in my garden because it was so nice to be outside in some nice weather. And hopefully some of the things I can share with you might help if you're thinking of going to surgery to get you better prepared and know what to expect and make the whole thing a lot easier. When I did go in for surgery, I had read that some people do get a nerve block under the arm, which can be a fairly painful shot, and the arm can be pretty much dead weight for a half a day up to a day and a half after until the block wears off. In my case, my surgeon did not do that. He put me on under a general anesthetic. First of all, mine was a fairly long surgery since it involved 2 fingers and the thumb. And secondly, that's the way he likes to operate, which brought up something I had not been prepared for, and that is the effects of the anesthesia itself. A lot of people can get very nauseous and can do a lot of vomiting. I was looking at just how that would impact living alone with one hand non-functional, and I got a little more nervous about that than anything else. As it turned out, I had some advice. Talk to your anesthesiologist before you go under. I told him that I was concerned. He said he could come up with an interesting cocktail that probably would be very considerate of my issues. He also suggested, he asked me whether I ever got seasick, which I do, if the patch worked well for me, which it does. And he ordered a scopamine patch, which they put on before surgery. And I'll tell you, not a bit of nausea or sickness or anything. It worked like a charm. I have another friend who also went under surgery, and she had an anesthesiologist who was very good at pressure points, and she said that worked magic for her. So there are no single answers, but if you have concerns, express them, talk to people, let it be known. It made the whole surgical ordeal far less of an ordeal. You make sure that you've got everything set up with someone to bring you to surgery and back, so you have a comfortable place to get into, so you have, as I said before, things lined up, backup help in case you need it, so you're not anxious. And just consider you're going to be taking a somewhat painful vacation. Everybody's different. Whatever I say to you that works for me may not work for you, or may work great. Be aware. This is you and your body, and no two bodies react exactly the same. But the more you learn, the better prepared, and the better the experience is going to be. Now, this is the soft cast that they put it in, which is basically a pretty intensive bandaging. And as I mentioned before in previous videos, it does not come with a little face on it. So if you want a face, you either have to hire somebody to do it for you, have a friend do it, or try to do it with your left hand. I was pretty proud of that. Anyhow, the soft one is beginning to be a little uncomfortable for me. I'm really ready to get rid of it. And tomorrow, which is the 22nd, tomorrow's 23rd of November, and I will be going in to have this removed. I'll get to see what's underneath, which I hear can be pretty freaky. We'll see. And then they give me the hard cast. And I've been told that's going to be a lot more comfortable. Hopefully I don't have to be quite so worried about keeping it dry. And hopefully it'll be more physically comfortable. We'll see. But I will report on how the hard cast goes tomorrow. I did also want to mention about pain. I was put on some pretty heavy pain relievers. They did have opiates and acetaminophen. And I did stick to them for the first 4 or 5 days and then weaned myself off as quickly as I can, because my own personal take on drugs is less is more. I really don't like the side effects. I don't like the possible consequences of taking drugs, so I stay off of them as much as I can. But remember, your little body is going to get very insulted with what's going to happen to your hand. So, give it a break. Take a little help if you need it. Get yourself off it as long as it takes. I'm not even on Tylenol now, and it's just under 2 weeks. Occasionally it hurts. I can live with the pain because that's what I choose to do. Again, keep yourself informed and make your own decisions on what's going to work for you. And I'll let you know what goes with the hard cast on my next little video. Stay watching.